I'm Lee Greenberger. I'm the Chief Scientific Officer of the Leukemia Lymphoma Society. I'm here today to tell you about what we are planning with the International Waldenström Foundation moving forward to achieve better control of the disease and long-term cures for Waldenström's macroglobulinemia. And the reason why we're so excited about the future is because there has been many changes in Waldenström's in the past few years that have enabled new therapies, and we have a much better understanding of the disease. And for that reason, I've worked with Carl Harrington to, in the next couple of weeks, actually in 2 weeks from now, we're going to be bringing together experts from around the globe to discuss what is the future for research into Waldenström's macroglobulinemia. So there really are 4 fronts for Waldenström's that we think are very exciting. Of course, with the new approval of ibrutinib, it's already telling us that signal transduction pathways are really important for control of the disease. But the signal transduction pathways still have a lot to be understood, and we think it's really promising because we can see not only the control of what is the target for ibrutinib, this new drug that just got approved by the FDA, but that whole wiring diagram now is beginning to be understood. And in particular, the wiring diagram includes a mutation found in about 90% of Waldenström's patients, this target called MyoD. And we now are seeing drugs being developed for beyond the BTK pathway, which is the subject of ibrutinib, but to begin to imagine new agents that will target that pathway and be used in combination with ibrutinib in the very near future. So we're very excited about control of that pathway. Beyond that, we need to understand all the pathways that control Waldenström's, because we think that by getting a better understanding of all these wiring diagrams in Waldenström's, we're going to lead to new targets that we haven't even considered yet. Moving on, there is an explosion of what's going on in the immunotherapy control of lymphoma and leukemia in general. For example, the immunotherapy approach now indicates that we can activate the immune system in 2 ways. One is to actually just turn it on, and the other one is to take the brake off of the immune system. And what I mean by this is this personalized therapy called CAR-T, and I won't go into the details, but suffice it to say that we now can take the immune system and genetically modify it and activate it. And when it does that, it will recognize tumor cells, in particular leukemic cells, but now we think also lymphoma cells, possibly even Waldenström cells, to home on the tumors, and these T cells will kill the tumors. And we've seen tremendously effective results in leukemia, partial effective results in lymphoma, and we'd like to apply that to Waldenström. So that's one area of immunoactivation. The other part of immunoactivation is to take the brakes off the immune system. And what I mean by that, it turns out there are checkpoints that control the immune system and turn it off. And Waldenström's and many other of the hematologic malignancies have devised mechanisms to turn off the immune system. Well, it turns out that you can use antibodies to block these so-called checkpoints, and it activates the immune system or reawakens it. And when that happens, these antibodies have therapeutic effects in leukemias and lymphomas. And we think we can be able to apply that to Waldenström's. The other area that we're excited about is to learn how Waldenström's interacts with the environment that it's growing in particular in the bone marrow. And we now know that there are controllers of how Waldenström cells interact with the environment, leading to possible new therapies in the future. And finally, even though we've analyzed some of the genetic defects in Waldenström's, we know there are other genetic defects that lie ahead. We've already seen some of them, and we need to get a much better understanding of what other genetic defects exist. We think this is really important because we know from looking at other lymphomas and leukemias, there's this so-called tail of mutations, the less frequent mutations in, for example, than MYD88. And those mutations turn out to be also, some of them turn out to be drivers, and they're targets for new therapies. So those areas are what we're going to be talking about at the upcoming Waldenström's Roadmap Symposium, beginning to plot out what are the new therapeutic approaches, what are the new sources of material that we need, what to understand the pathways, and what are the new therapeutics that we need to ultimately make Waldenström's a long-term disease control and ultimately cures for the disease.